in honor of Feet Finders, we're going to gather our equipment. We're going to wash our hands. We're going to provide for privacy for our patients. So I would close the curtain, close the door, whatever I'm using for that. Can you give me your name and your date of birth?
Andrew Wazalewski, May 25th, 1998.
Okay, all right. So Andrew, my name is Jamie. I'm going to be your nurse today. Is that all right?
Yes, ma'am.
Okay. So we are going to do a neck, heart, and lungs assessment on you. That will require me to touch you, and I will need to use my stethoscope on you as well. Are you okay with that?
I am.
Okay, fantastic. Along with that, I want to make sure that my patient is safe. So because I made him just take off his shoes and his socks, technically he is, well, he's better than your shoes actually, the way you're sitting right now, because your shoes are slippery. But regardless, okay, checking for non-skid footwear. I'm checking to make sure that the bed is in the locked and low position if that is appropriate. The call light is within reach. I want to make sure that my patient, if the bed rails need to be up, they're up, or if he is sitting on a table, that he is stable, so he's not slumped over or anything. I'm good with that, right? Okay, so along with that, I'm going to take a look at your neck, if you don't mind. Flip that, just make sure I hit everything. So as I look at your neck, I'm looking from the right to left side, and I'm kind of drawing an imaginary line for myself, and I want to verify that the right side and the left side look the same. Along with that, I'm looking at your trachea, which to me looks like it's midline, but I can have you hyperextend just a little bit, again, to look, or if I can't tell, I can always go, can I just touch you right here? Mm-hmm. Okay, all right, and I can feel that his trachea is midline. And then from there, I look at his skin. So, all right, his skin is warm and dry. It is congruent with the rest of his body. Let's see. I'm happy with that. All right, so if I were to assess for JVD, I would put the head of the bed back 45 degrees. Because you are not in a bed, you can't do that, and I'm not going to make you do that. However, I would assess right and left side at 45 degrees, looking to see if there is any jugular venous distension. You do not currently have any. All right, so then I'm going to palpate your carotid artery. I'm going to do one side at a time for your safety and mine. So right here, right there, and then again on the other side, because bilaterally we have carotid arteries. So your carotid arteries are 2+ smooth bilaterally. So then we're going to go, and 2+, I did say that. We're going to look at your neck vessels. So when I do this, I'm going to have you take a breath in and hold. So just kind of relax. I'm going to take a breath in and hold. As I do that, then I'm going to go through and I'm going to listen to those same 3 spots that I touched before on each side. I'll give you a break in between. Is that all right? All right. So take a breath in and hold. Okay, and you can breathe. Remember that I am doing this with the bell of my stethoscope, so if I'm going to hear a bruit, that's how I'm going to do it, okay? All right, take a breath and hold. Okay, and no bruits noted. All right, so then we're going to go to the back side of him, and we're going to look at the posterior and the lateral aspect of his back. So as I look at his back currently right now, I do not see any respiratory distress, and I see a regular rate and rhythm, okay? Along with that, I am going to check my AP diameter. So to do my AP diameter, I'm gonna actually put my hands right here, and I'm gonna go one to the side. So we have a 1 to 2 AP diameter on my patient, and that is what I would expect. So then from there, I'm going to take a look at my color on the back of my patient's back, which is why a tank top would be appropriate, right? So color is congruent with the rest of the body. I'm going to feel we are warm and dry. I do not see any rashes or lesions, and he is clean. All right? So with that being said, actually, before I do that, we're we're gonna do his breath sounds. So when I do this, I'm gonna ask you to take a breath in and let it out. You do it at your pace, don't rush for me, okay? So I have my suprasternal notch here, right? And so right there is where I want. Nice big deep breath in and let it out. I listen for the whole respiratory cycle whenever you're ready. I went a little early on that one. Don't do that. Julie will get you. Take a break. Don't want you passing out.
That will happen.
It's not gonna happen, not with all your training, right?
Right.
Okay, go ahead and take a breath. And I'm gonna do it, both of them on this side, and then I'll switch to my other side. Okay, so my lung sounds are clear throughout. All right, so then we go to the other side of the paper. So as I do that, I again am looking at his chest, and I am looking to see if there's any respiratory distress, and I see no respiratory distress, and we have a regular rate and rhythm. So again, I'm looking at the color on his chest, and his color looks congruent as best I can with the rest of his body. He is warm and dry. I do not see any rashes and lesions with what I currently see. He is clean. So then from there, I have to go to my apical pulse. So I'm gonna touch your chest, which will be right under the left breast. And I am touching to see his apical pulse. His apical pulse is 2+ with a regular rate and rhythm. Okay. Along with that, I have to look for my heaves, lifts, and thrills. So we're gonna check the apex, the left sternal border, and the base. And there are no heaves, lifts, or thrills present. So then I'm gonna go through and I'm gonna listen to your heart. There are 5 areas that I'm gonna listen to your heart. So we have the second intercostal space on the right sternal border, which is your aortic area. On the second intercostal space on the left sternal border, that is your pulmonic area. The third intercostal space on the left sternal border, that is Erb's point. On the fourth intercostal space, left sternal border, that is your tricuspid. And then to look for the mitral, very similar to where I was with the apical, is your fifth intercostal space, left midclavicular line. So those are the 5 areas that I'm going to be putting my stethoscope on. As I do that, I have to do both with my diaphragm and with my bell. So you'll actually have me listening to you for a little bit of time. Just try to relax. You don't have to breathe for me or do anything special for me. I'll do all the work.
Sounds
Okay?
good.
Very nice. So S1, S2 is present, regular rate and rhythm. There are no murmurs present. So thank you for letting me do that. So then we go to your peripheral vascular. So I'm gonna have you just kind of put your hands out, if you will. All right. So your, cold and clammy hands again. Okay, you can just rest them down on your, on your legs. Okay, so kind of feeling down his hands and his arms. So your arms are nice and warm and dry. There's no edema present. When I check skin trigger is normal. When I look at your hands, seeing you have your fingers, nope, you can just leave them like they are. So I'm checking my cap refill on both sides. My nails are pink and smooth. I have instant cap refill. I'm going to check my radial arteries. And they are 2+ bilaterally, regular rate and rhythm. Okay, just make sure that I didn't see any rashes or lesions on his upper extremities, and I did say no edema. So then we're gonna go to your feet. So again, I'm looking at the color. So going down from the knees down. Again, your feet are a little chilly as opposed to the rest of you. He does have evenly distributed hair. His skin is congruent with the rest of his body, though it does look like he has a little smashing of his knee at some point. I do not see any obvious varicosities. Oftentimes if I see that, I'm gonna see them on the back side of the leg. Though sometimes you'll see them in different spots. I don't have any edema present. No lesions. So I look at his toenails. His toenails are pink, smooth, to the best of their ability. I do get instant cap refill. On top of that, I need to go through. And I'm looking for a dorsalis pedis here. I'm looking for a dorsalis pedis here. And then my posterior tibialis. Posterior tibialis. So I have all of my DPs and my PTs. So dorsalis pedis and posterior tibialis are 2+ regular rate and rhythm bilaterally. I don't know if I said you were warm and dry, other than your feet are a little chillier. No edema. Thanks.
Thank you.